My name is Joann Yao, and I'm the Director of Marketing for ImpediMed. I'm going to talk a little bit more about our lymphedema prevention program and our goal of ending cancer-related lymphedema. Lymphedema is a huge problem impacting cancer survivors. We know that 1 in 3 at-risk survivors will develop lymphedema, and the cost of this care is tremendous, almost $7 billion to our healthcare industry annually. Lymphedema is the leading post-surgical complication for many cancer patients and the most feared consequence of survivorship. And it's so feared because it dramatically reduces patients' qualities of life. Not only do they have to cope with the symptoms like swelling, pain, infections, but they also have a higher degree of depression, and have reported that lymphedema is a constant reminder of their cancer diagnosis and treatment. Not only that, but the financial burden of lymphedema is very high, not just to the healthcare system, but to the patient as well. Patients have lost productivity due to their lymphedema and also have to bear the cost of treatments. But now we know that lymphedema is preventable. The PREVENT trial, which showed that breast cancer survivors whose lymphedema was detected and treated at an early stage had a 95% reduction in the progression of lymphedema. So why is this possible? Well, it's about catching lymphedema early. And what this study showed from the University of Kansas is that when they used a prevention model of care to detect lymphedema at an early stage, they were able to resolve it. In fact, if you look at the chart on the right, of the stage 0 patients whose lymphedema was detected at stage 0, 100% of those patients had resolution of their lymphedema. For those whose lymphedema was detected at stage 1, you see that 2 of the 17 progressed, so 15 had resolution, and all of the patients whose lymphedema was detected at a late stage 2 or stage 3 were not able to have resolution. So what this means is that the opportunity for reversal is really before a patient experiences symptoms. So once a patient is starting to experience symptoms, you reduce the chance that you're going to be able to reverse it. And what that means is that we need a way to detect that subclinical lymphedema before a patient gets to the symptomatic stage. And there are a number of approaches for detection, but what we've found is that the only truly reliable detection tool for subclinical lymphedema at this time is SOZO with L-Dex. So tape measures have been shown to be inaccurate, especially if they are used by different people at different times. There's a lot of subjectivity in those measures. Pyrometry, that is an option, but it can be time-consuming as well. And of course, imaging, while it can be very effective, may not be readily available on a routine basis. SOZO with L-Dex, on the other hand, has the capability to detect changes in fluid as small as 2.4 tablespoons. It's validated against lymphoscintigraphy, a leading imaging approach to detect subclinical lymphedema, and has been shown to be 80% sensitive and 90% specific in detecting subclinical lymphedema. Furthermore, it's a non-invasive 30-second test that can be integrated into any clinical practice setting. The way that SOZO is implemented in practice for lymphedema prevention is quite simple. It's as simple as test, trigger, treat. Test, that means routine testing of patients who are at risk for lymphedema development using L-Dex on the SOZO device. A trigger is when an L-Dex score increases 6.5 over baseline, which indicates subclinical lymphedema. And the treatment that was used in the PREVENT trial is compression garments for 4 weeks, 12 hours a day. So let's look at how this translates into a typical patient workflow. So a typical workflow really begins with identification of the patient. And that's when a physician would identify a patient is diagnosed with cancer and should be referred for lymphedema prevention. Once they're in that program, then a patient would get a pre-treatment baseline L-Dex score, and this happens before any of the cancer treatments begin. Then the cancer treatments can begin, and after surgery is when the post-treatment follow-up really should start again with L-Dex. And this is a proactive surveillance approach where patients are being tested using L-Dex every 3 months for the first 3 years, every 6 months for years 4 and 5, and then annually thereafter. And during this time, if the patient's L-Dex scores remain normal, then that patient would just continue monitoring through this entire follow-up period. If at any time the patient did trigger for subclinical lymphedema, the clinician would definitely assess that that is in fact lymphedema, and the patient should be treated with a compression garment or other intervention to prevent that lymphedema from developing to a chronic state. At the end of that intervention, of course, the patient would come back in for L-Dex, and if the lymphedema resolved, continue on this monitoring course. Now, this comprehensive program does apply to any patients who are at risk for limb lymphedema. So when you think about who should get the pre-treatment baseline L-Dex score, really that's all patients whose cancers are associated with lymphedema risk. That could be breast cancer patients, melanoma patients, those patients who have pelvic area cancers, because all of these cancers can put the axial or inguinal lymph nodes at risk. When you're thinking about who would go into that post-surgical testing, that would be patients whose treatment put them at risk for lymphedema. So those who had a lymph node dissection or biopsy. Mastectomy for breast cancer patients does carry a lymphedema risk, as does any nodal irradiation, as well as taxane-based chemotherapy. To sum up, there's many benefits of implementing a lymphedema prevention program in your practice. First is the opportunity to achieve a dramatic reduction in chronic lymphedema among your cancer patients. We have demonstrated that this program can be integrated into your existing clinical workflows, and it is comprehensive and can benefit any of your cancer patients whose treatments put them at risk for lymphedema of the arms or the legs. To learn more, please visit preventlymphedema.com. Thank you.